Now let's discuss vitamin A deficiency. Vitamin A deficiency can also cause metaplasia, and this is because vitamin A is needed for the differentiation of specialized epithelial surfaces. In vitamin A deficiency, the thin squamous lining of the conjunctiva undergoes metaplasia into stratified keratinizing squamous epithelium, and this transformation is known as keratomalacia. Grossly, an eye with keratomalacia appears cloudy with a softened cornea. Here's an image of this. Note the cornea right here that appears softer and more gelatinous in consistency. The last example of metaplasia we'll discuss is myositis ossificans. This is a metaplasia of connective tissue. So in this type of metaplasia, muscular tissue undergoes metaplasia to become bone, and this usually occurs after injury as part of an erroneous healing process. Here's an image of a patient who has undergone surgery, as we can see by the screw seen on this plain film right here. And we can see the cloudy hyperdense region right here, which is suggestive of bony changes of the healing muscle surrounding the screw. So essentially the muscle has turned into bone. All right, let's finish up by discussing dysplasia. In simple terms, dysplasia refers to disordered cell growth. Unlike the other growth adaptations I talked about in this presentation, dysplasia is not a true adaptive response. Dysplasia is usually preceded by long-standing pathologic hyperplasia or metaplasia. One thing to keep in mind is that dysplasia is non-neoplastic, but it can be precancerous. For example, CIN, or cervical intraepithelial neoplasia, is a dysplastic precursor to cervical cancer and is characterized as a precancerous lesion. Mild and moderate dysplasias, which do not involve the entire thickness of the epithelium, may regress with alleviation of the inciting stress. So dysplasia is a reversible change. However, severe dysplasia becomes irreversible and may progress to carcinoma if the stress is not removed. Dysplastic cells are characterized by loss of tissue architecture and nuclear changes. Nuclear changes include an increase in the nuclear to cytoplasmic ratio, or N to C ratio. This occurs as the nucleus increases in size at a rate greater than the cytoplasm, and we also see chromatin clumping within the larger nucleus. All right, now that we've covered the information, let's review with a question. A 56-year-old male with a chronic cough, numerous respiratory infections, and a 40-pack-year smoking history presents with streaky blood in his sputum. Chest X-ray reveals hyperinflated lungs but no infiltrates or masses. Bronchoscopy is performed and samples of bronchial mucosa are biopsied. Microscopy reveals areas of stratified squamous epithelium. The pathogenesis of this patient's microscopic findings is most similar to which of the following conditions? A. Barrett esophagus, B. Hypertrophic cardiomyopathy, C. Streak ovary, or D. Cervical cancer. All right, we have a 56-year-old male with a chronic history of smoking. And we're told that microscopy reveals stratified squamous epithelium instead of the normal ciliated columnar epithelium that would be expected in the bronchial mucosa. So this is an example of metaplasia, making A the correct answer, because Barrett esophagus is the only example here of metaplasia. If we go back to this slide on metaplasia, we discussed Barrett's esophagus in some detail. And remember that metaplasia is a stress-induced reversible conversion from one cell type to another. In this case, ciliated columnar epithelium to stratified squamous epithelium. B is wrong because hypertrophic cardiomyopathy is an example of hypertrophy. C is wrong because streak ovary is an example of hypoplasia. And finally, D is wrong because cervical cancer is not an example of a growth adaptation, since it's a reversible cancerous process. So again, the correct answer is A, Barrett esophagus. And that concludes this section.